Hi, everyone. Thanks for being here today. My name is Helen Wick.
And I'm Sohad Hammad, and I'm here on behalf of my team and co-founders, the Vivetha team, to present our solution to provide affordable and accessible healthcare for low-income workers. Let me ask you this first. Have you ever skipped a doctor's appointment because you were just too busy with work? You didn't just have time to drive for another 20 minutes to go for a doctor just for a checkup? Well, you're not alone. Especially low-income communities face issues such as lack of time or money to address critical health concerns, potentially leading for long-term health implications. In the US alone, 32% of workforce earn less than $15 an hour. Not even a third of low-income workers obtain health insurance through their employers. In 2021, out of all states, Mississippi scored lowest on the health system performance score. Workers in Mississippi are earning way below what is needed to afford health care, including people like Lisa. Lisa is a 34 years old Walmart employee living in Mississippi, and she works part-time. Her wage recently increased to $10 an hour, but doesn't provide her with health insurance. Lisa was diagnosed with high blood sugar and pre-diabetic stage, but she can't seek medical help due to long working hours and cost constraints. The solution to Lisa's problem is expanding Optum's current mobile clinics and leveraging existing partnerships. These mobile clinics will be sponsored by corporate employers, such as Walmart and other big box employers, and it will be deployed on site. Employers are thus improving the health of their workforce, increasing productivity, and lowering overall insurance costs. By opening up the service to other community members, they will also boost their sales and CSR efforts. These mobile clinics will be scheduled to visit employers in their work sites on a regular basis for workers and other community members to access the clinic easily. We will work 6 days a week, 10 hours a day, providing care to almost 60 patients a day. 2 social workers for administrative tasks, and we're going to have 2 family nurse practitioners for consultations. We're going to have 2 teams of those, and they're going to be rotating. Proactive vehicle maintenance once a month will also ensure continued high-quality service and reliability.
The benefits of this approach is that it solves the challenges of accessibility, affordability, and time constraints for Lisa and communities like hers. It takes Optum's current approach and reduces its size and capacity for daily operations and deploys a larger, more specialized vehicle for monthly visits that would require referred care otherwise. Mobile clinics result in an average of fewer emergency room visits each year, translating to an average savings of 1/5 of the cost of care. Mobile clinics also have shown to reduce the amount of emergency room visits over time, and they are also more affordable and have less costs than brick and mortar clinics. This provides quality care that is flexible and accessible. Some of the risks associated with this model are challenges finding culturally competent employees, especially considering the high attrition in this space due to high stress and compassion fatigue. There's also fragmentation from the broader healthcare system and referrals. In order to mitigate these risks, it's important to have strong resiliency training, mental health support, and manageable schedules, as well as building strong relationships and systems to connect patients with other services. Based on our projections and corporate sponsors, we project around $2 million in revenue in year 1 In year 3, having approximately $11 million of revenue, and in year 5, nearly $17 million of revenue. In order to achieve this, Optum can implement the timeline of having 1 mobile clinic in year 1, serving nearly 17,000 community members. In year 3, having 5 mobile clinics, addressing 86,000 community members. And in year 5, having 10 mobile clinics, serving nearly 172,000 community members. We recommend entering the market in Lisa's state of Mississippi. Mississippi has the highest healthcare gap in the United States, the lowest minimum wage, and the highest percentage of uninsured hourly workers. There are nearly 500,000 low-income patients in Mississippi alone. To successfully achieve this, it requires branding, outreach, and strong community relationship building. This marketing strategy will assist in expanding Optum's efforts at scale. In order to achieve this scale, we recommend increasing the number of mobile clinics across the United States, especially focusing on other states that have a high health disparity, such as West Virginia and Oklahoma. We encourage maximizing partnerships with big box stores like Walmart and expanding into markets that have low healthcare access that Optum currently operates in, such as India and Brazil. This corporate-sponsored mobile clinic can provide quality care to communities like Lisa's across the globe. Our team here at Vivetha is in the seed round of implementing mobile clinics in Colorado and beyond. If you're interested in learning more, please come find us. We are looking for collaborations and sponsors. Thank you.